Now, there are tens of thousands of people in Yorkshire living with celiac disease, but research by the BBC has discovered that the amount of help available on the NHS depends really on where you live.
Now, in Sheffield, people with the disease currently get prescriptions for gluten-free food, but the amount available is being halved. York has become the first place in the country to offer supermarket vouchers instead. Olivia Richwald can explain.
Thank you. Most people with celiac disease don't know they've got it. It's estimated to affect tens of thousands of people in our region, but takes on average about 13 years to detect. It can lead to illnesses from eating things which contain gluten, like bread and pasta. Symptoms include bloating and fatigue, but if untreated, it can cause cancer and osteoporosis. You need a strict diet, but gluten-free products cost 3 times as much as their equivalent. Now, in some areas, the NHS is changing or cutting support, and I've been speaking to 3 people who have the disease.
William Hardy was diagnosed with celiac disease when he was 18 months old. He'd been sick for 76 days in a row. Mum Kate ensures he remains healthy with a strict gluten-free diet. William has his own cupboard, own snacks, own butter in the fridge, because even a crumb of bread could cause a reaction in his body. Every month he receives a prescription for gluten-free bread and pasta, saving the family hundreds of pounds a year. But even with the NHS help, shopping bills are an extra £40 a month.
All products that we buy gluten-free are expensive. You know, you pay a huge markup. For example, a loaf of bread, you can spend £3, whereas a normal, regular loaf of bread is, £1.25. So it makes a big difference, especially to a family.
Kate is worried that gluten-free prescriptions might be phased out or reduced in the future. In Sheffield, that's exactly what's happened. Prescriptions have been halved, saving the NHS £225,000 a year, but costing people like Jackie Bailey more at the supermarket tills.
Well, the number has been, units has been gone down from 16. It's been halved to 8. So that equates to perhaps maybe having to buy another 8 loaves of bread, which is about £25 a month. So that will impact on people's budget, especially if you're a student or you're somebody on a low income.
In York, Gillian Rickard is one of more than 100 patients trialling a new scheme which swaps prescriptions for supermarket vouchers. She gets £14 a month to spend in her nearest Morrison's.
Personally, it's worked well for me because it means that I can actually choose items that I want at the time that I need them. It would be much better if there was a national policy which applied to everybody, as there is in Scotland and Wales and Northern Ireland.
Now, we all know the NHS needs to spend its money wisely, and Sheffield used to have the 2nd highest prescribing rate in the country. Now, this is the problem. A loaf of bread on prescription costs the NHS £6, but a patient can walk into a shop and buy the same for less than £3. And that's why the voucher scheme in York could ultimately save money. Meanwhile, the NHS has been advised that it could save £10 million a year if all areas followed Sheffield's example and halved gluten-free prescriptions.
Thank you, Olivia. Well, Professor David Sanders from the Royal Hallamshire Hospital is a leading expert on celiac disease. Now, he's worried that the cuts to gluten-free prescriptions will cause health problems in the future.
I think in the long term that risk will be clear. About 40% of people who have celiac disease have reduced bone thickness or osteoporosis. So if you are not adhering to your gluten-free diet, if it becomes unaffordable to you, then over the long period of time you're at greater risk of these complications.
Are you, as an expert, in favour of the experiment in York where they're using supermarket vouchers, or would you prefer to go back to the full prescription?
I think any solution other than cutting is worthwhile, and the patients in Sheffield are very concerned by this. They did not feel they were consulted. There was a public meeting after they were told that these prescriptions would be cut. So alternative methods should be explored.
Do people worry that they are perhaps being treated as if this was some kind of lifestyle choice as opposed to a disease?
Absolutely. I think that is part of the confusion. There are people who are on a gluten-free diet as lifestyle choice, but people with celiac disease have a disease. It inflames their gut. They can't help that. When they eat gluten, that's what happens, and it gives them significant symptoms. So undeniably, they feel that they're being caught in this trap, and that if it was a tablet that they took, or insulin or something of that nature, nobody would ever consider cutting it.
In Sheffield, the reason the CCG give is that for cutting these prescriptions is that there are too many people now who are diagnosed. Is that perhaps your fault?
I think it certainly is. Sheffield is viewed as a national centre of excellence for celiac disease. General practitioners and in secondary care were very good at recognising these cases, and that's well reported. Most people would view that as excellent healthcare and not a reason to then do something as retrograde as this.
And a lot of people out there who have celiac disease are not clinically diagnosed. Why is that?
People with celiac disease present in many different ways, not just gut symptoms. You might be tired, you might be anemic, you might have one of the other autoimmune diseases that's linked, like type 1 diabetes or autoimmune thyroid disease. So it's a difficult disease to pin down sometimes, and Coeliac UK, the national patient charity, report a delay in diagnosis of something like 13 years.
Right, okay. Thank you very much for joining us tonight. It's very interesting. Thank you.